Hello, good afternoon. Welcome to Communities Live here on Sheffield Live 93.2 FM. And we have a very special guest here today. We have RTV Lorraine's Dr. Amir Khan. Good afternoon.
Good afternoon. Thank you for having me.
Thank you for joining me. So, my first question to you is, who inspired you to become a doctor?
Yeah, it's a good question. I'm not one of those people who always wanted to be a doctor. I was always very jealous. When I was at medical school, of all those people going, "Oh, I always wanted to be a doctor. My dad was a doctor, and I really wanted to follow in his footsteps." We didn't have any real medics in our family. None of my extended family were doctors either. And actually, it was I worked, like loads of people at school, to earn some money. I worked all through the summer holidays, and I got a job in a nursing home. And it was on the back of that I realised, actually, when the GPs came to visit the nursing homes, and I would accompany them on some of their rounds as one of the auxiliary nurses there. I thought, oh, actually, that's a job that feels very rewarding and community based. I knew I wanted to be community based, and it was on the back of that.
I've got to say, I mean, you've been on RTV's Lorraine, Good Morning Britain, amongst other good morning shows. I mean, tell us a bit about that. How did that come together?
So again, completely by accident. I was just working quite happily in my surgery in Bradford, where I am now. And Channel 5 initially came to us and said they wanted to film a show called GPs Behind Closed Doors. That was 5 years ago. And because I've been working here for so long, I know the patients so well. I think that kind of interaction I have with my patients, but again, it comes from familiarity. I've seen them, I know them, reflected really well on the show. And on the back of that, I did some other things for the BBC, and then ITV asked me to come and join their daytime team, which has been absolutely brilliant. And yeah, I've loved it. And they've been really accommodating in that. They know I work full time as a GP, and that if they do need me while I'm at work, they're quite happy for me to do it from the surgery. I don't have to go down to London because I live in Leeds, I work in Bradford. I can't get down to London. I've got patients to see.
And we're coming to a time now where people are going away abroad on holiday, and it's the weather's getting really nice, and there's a lot of TV shows that are quite. You see a lot of TV shows that are abroad. Do you feel like they give a false impression about not mention when they don't mention like the risks of diseases or anything like that?
Yeah, I think a lot of those glossy TV shows, their job isn't really to give health advice. Their job is to entertain. So a lot of these shows that are based in countries abroad, like Emily in Paris, and one of my favorite shows, White Lotus, all of those places which make, those kind of beautiful, sunny countries look amazing, are very enticing to people. And it's probably not within their remit to give the safety advice. And that's where us healthcare professionals come in. And that's what this campaign is all about. People will see those places and go, right, I would like to go there. And often people book holidays last minute, or they're so excited about it, they forget about the health and safety kind of side of things, because it's not as glamorous as choosing your bikini or your swimming shorts. And so they forget about it. But this is what this campaign's all about. What we're trying to raise awareness of is the dangers of things like mosquitoes and the need for vaccines when you travel abroad, should you go to certain countries. And all of that information is in one place on this website called bewareofthebugs.com. All you have to do is visit that website, put in where you're going. It will tell you if you need to take any precautions against mosquitoes and the illnesses that they can carry, plus any vaccines you might need. And really importantly, it connects you then to a local travel clinic. And this is all free. That website is free. It connects you to a local travel clinic who will be able to give you more advice and administer any vaccines or give you any malarial prophylactic drugs you might need.
And as you said, mosquitoes are quite common in holiday destinations, and they also carry the deadly virus malaria. So for anybody who is going abroad just last minute and they haven't had the vaccines or precautions, is there a way that they can prevent being bitten by mosquitoes?
Yeah, so the mosquitoes are everywhere. They're even here. They're in my garden for sure, because when I go out in the evenings, I get bitten to bits. But the mosquitoes here don't tend to carry some of the illnesses. But what we're seeing is those kind of tropical illnesses that we associated normally with kind of sub-Saharan Africa, parts of South Asia, because of climate change, these mosquitoes that carry those illnesses then are traveling further north and to parts of Europe as well. So what we want people to do is, look, you can try and reduce your risk of getting bitten for sure. Wear mosquito repellent with at least 50% DEET. Wear long trousers and long sleeve shirts to reduce that risk as well. But really, what you need to do, because they're determined little things, mosquitoes. If they really want to bite you, they'll find a way. And so the best thing to do to avoid getting any illnesses that mosquito might be carrying is go to this website, bewareofthebugs.com. It will tell you if you need any tablets to prevent malaria. It will tell you if you need any vaccines, and it will tell you where to go for that. But it's not just malaria that mosquitoes carry. There are other illnesses as well, really serious ones like dengue fever, Zika virus, yellow fever, all of these things that living in the UK you don't really think about. And when you're watching TV shows and they're all very glamorous and Emily's walking around in beautiful clothes in Paris, it's one of my favorite shows. I love it. But you don't hear Emily going to the fashion designers and then getting a vaccine for yellow fever. I mean, to be fair, you don't need it in Paris, but you can never be too careful.
And besides other than mosquitoes, I mean, another problem with going abroad, in fact, even in this country as well, is sunburn and sunstrokes. And
yes,
a lot of people forget to put on like sun lotion or Factor 50 or whatever. I bet that's a common problem as well, isn't that?
it is. It is. We've had this recent spate of beautiful weather, hot weather, and I, as a GP, I have seen children with burns, and it's really disheartening because children have really sensitive skin. But what the message really is, it doesn't matter whether it's cloudy or sunny. Everybody should be wearing some kind of SPF, sun protective factor. Ideally, we should all be wearing SPF 30 or above. Children definitely need 50, and those with fair skin or who've had previous skin cancer need factor 50. But what I would say, because everybody's like, oh, I won't get skin cancer, I only went into the sun for a short period of time. Trust me, I'm a GP. I see patients who don't spend that much time in the sun but still get skin cancer. You just never know. Or people will, because I work in Bradford, I see a lot of patients who are South Asian, and they think the melanin, the brown pigment in their skin will protect them, and to a degree it will. But doesn't matter what your skin color is, you're still at risk of skin cancer. You still have to wear SPF 30 minimum. And you know what? If for nothing else, the sun ages you, and you want to stay as young looking as possible for as long as possible. And the best way to do that is to wear SPF 30 or above. And they put it in makeup now, so you don't have to lather on cream. If you're going out and about, you can get makeup with sun protective factor in as well.
Do you feel like the current climate change has affected how we are getting diseases?
Yes. We're seeing tropical diseases that, like I say, we would expect to see in more kind of cooler countries coming our way. Just yesterday, there were 2 cases of malaria reported in parts of the US, and that's something that hasn't been recorded there for over 20 years. So we're seeing the warmer climates are driving these insects further north because, that's the climate they like. And it works both ways. Things like midges that are normally kind of in Scotland, in the Highlands, they're coming further south as well. There are insects and illnesses that were once probably considered tropical, making their way to more temperate climates.
And I've got to ask, Amir, we've got there is some people are don't have like online access to like websites and stuff like that. So it's like if people don't have internet, I mean, probably not many people do. How can people get the word across to take more precautions?
So if you don't have access to bewareofthebugs.com, the other thing you can do is visit your practice nurse at your GP surgery. They are usually well versed in travel health. I would speak to the receptionist at your GP surgery, find out who your travel health person is at that clinic, and book in with them if you're going abroad. And the other thing I would just add is make sure you have health insurance when you go abroad, because all of this stuff will hopefully prevent you from getting ill. But if you do get ill, you don't want a big nasty bill at the end of it. You get health
Sure.
insurance before you go.
You feel like, do you feel that there could be, but there's more that could be done to help people get more aware and also to protect themselves?
I think it's always good that to give information, and have people signposted to useful websites and poster campaigns and that kind of thing. But also, it's important that we as healthcare professionals are telling that at every opportunity to our patients as well. But that's the beauty of this website, which is why I'm really backing it. It's free and it gives all the information you need, and that is bewareofthebugs.com. It's so easy to remember. I wish I came up with the slogan, bewareofthebugs.com. It's such an easy website to remember.
And my final question for you, Amir, is there anything that you would like to say to our listeners who are listening to this right now?
Yeah, I want you all to have a great holiday wherever you're going. Create memories, have adventures, just be safe. And the best way to be safe and enjoy yourself as much as possible is to take the precautions before you go. And all that information is on bewareofthebugs.com.
Amir, it's been a pleasure. Thank you for your time.
Oh, my pleasure, Chris. Thank you so much.